Hi, my name is Bertha Rivera. I am a registered nurse and I will be doing a presentation on workplace violence. According to OSHA, the Occupational Safety and Health Administration, 2 million Americans are victims of workplace violence annually. The Emergency Nurses Association states that 86% out of 1,000 members have also complained of workplace violence in the past 3 years. Some of the data from the Bureau of Labor Statistics shows that 21% of nurses and nursing students have complained of physical abuse, while up to 50% have complained of verbal abuse. Some of the data also shows that 80% of the incidents have come from patients. Well, what is workplace violence? According to OSHA, it is a violent act including physical assaults and threats of assault directed towards people while at work. There are two types of abuse. It is either physical abuse or verbal abuse. The University of Iowa Injury and Prevention Centers have come up with a 4-point model to break down the type of violence. The violence that we are dealing with in workplace violence is the type 2, a violence committed by a client or customers. So what puts your workplace at risk? It would be working with people who are violent, working with people who have been under the influence of drugs, working alone with patients, working in the presence of firearms, inadequate security staff, unrestricted public access, and the biggest of all is the perception that it should be tolerated. Who are the perpetrators in this situation? It may be patients who have mental health disorders. Usually 87% of those are patients with dementia, under the influence of drugs, the inability to handle a crisis at that time. Usually it is considered men between the ages of 35 and 65, and again, the availability of firearms and weapons. Who are at risk? And what sites are at risk more for workplace violence? It would be the psychiatric nurse, the nursing assistant, the nurses, the physician, usually women under the age of 40 who work longer hours and who have less work experience and who may not have had any kind of training in violence. The emergency rooms are big for that, psychiatric units, ICUs, the pediatric units, obstetrics, and of course you have your long-term care facilities, again due to the patients with dementia. What are the possible causes that have increased workplace violence? Well, it may be the many closures of many mental health facilities throughout the United States. It could be a reduction of the funding for addiction programs, patients who have been exhibiting some drug-seeking behaviors, crowding in the emergency rooms, which is causing longer wait periods, shortages of nurses, and misconceptions that we, the staff or nurses, do not care, and the visitor policy may not be getting enforced properly. Violence is costly, and it's not just in monetary form. You have the employee who has to get medical treatment. You have the employee who is missing work. The employee who is sometimes afraid to come to work because they are stressed out and therefore causing medical errors. You also have the patient who is no longer satisfied with the services that they are getting, so they go looking for another place. And then as far as actual cost goes, you have the employee who quits, leaves, gets transferred somewhere else, so now you have to deal with the turnover, the replacement, and the training. So yes, violence can be very costly. What are some of the barriers that people are not reporting this violence? It could be that they are fearing retaliation from the hospital staff. They lack any physical injuries, so sometimes even the police report may not show that there was any injury done. There's an inconvenience for reporting. Reporting might cause adverse customer service. Therefore, customers are no longer satisfied or they might be afraid to come to the facilities. And the biggest misconception is that violence is a part of the job. It is not part of the job. But again, that is a barrier. Ambiguous reporting policies, the lack of support for the administration, from the administration, and the idea is that reporting shows a sign of incompetence and weakness in the part of the employee. What are some of the solutions our leadership can put in place to deter violence in the workplace? Well, they can implement OSHA guidelines to prevent workplace violence for the healthcare and social service worker. They can make sure that we are aware of the problem and they are aware of the problem as well. They can adopt a zero tolerance policy, maybe implement a prevention program that will include how to better document and how to better report, policies to specify what to do in the case of an incident, a program to treat customers and patients and employees if there is such a case as far as support goes, and to make sure that staff is always supported. Some of the other solutions that we can also put into place would be making sure that all employees have an ID system. We can restrict access to visitors, make sure that there is a prevention and control program, safety and health training, improve the facility design. as far as making sure that there is a behavioral health center somewhere else within the hospital, or a psychiatric unit that behavioral patients can go to after the emergency visit and they get triaged there. Educate and raise awareness, and to learn to identify clients or visitors who may have signs and symptoms of violence. Some of the protective strategies that we can put into place would be to have self-defense classes, to have personal protection available to those who want to carry it, have personal cell phones that people can use if they are stuck in a situation where they know how to use their phone immediately and get help. Know how to get support and be supportive of the people who may be needing it when in times of crisis. And for those people who do make house visits, they may need to cut back on going to house visits in certain neighborhoods or after hours, or letting somebody else know where you're going to be at all times. Our leadership needs to make sure that policy is implemented. The American Nurses Association has adopted a Bill of Rights, stating that nurses have a right to work in a safe environment. The National Institute of Occupational Safety, along with OSHA, has also developed national mandates stating that hospitals or healthcare facilities need to make sure that they provide a safe environment for people to work in as well. JCAHO has stated that facilities need to make sure that they adopt policies that state it is no longer acceptable to be assaulted while at work. The Emergency Nurses Association has advocated for criminal penalties for those offenders who do commit violence in the workplace. As of 2012, 30 states have established such policies. So what type of leadership do we need to help implement these policies? It would be somebody who has emotional intelligence. That would be the ability to perceive, to understand, and control one's emotions while dealing with other people's emotions. That leader should be able to self-regulate, to motivate, to have empathy as to the cause or the solution to the problem, to have social skills. The leader works to resolve the conflict. They work to intervene. They work to identify alternatives that may help the situation. They recognize the feelings of the person who might be the perpetrator as well as who might be the victim. They are assertive with their communication skills, and they know how to negotiate. Our management needs to create an environment that is minimal of any kind of conflict, establish a workplace that has a zero tolerance policy. They are very strong with their authority, and they have resources that can help to improve the situation, and they can pursue alternative dispute resolutions. Everybody in the medical field knows the quote, "to do no harm." However, that does not mean that we as nurses also sit back and accept the status quo. If you feel your workplace is not a safe environment, speak up. Let them know how solutions may help. But just remember that workplace violence is not part of the job. I hope you enjoyed this presentation and it's helpful in one way or another. Thank you very much for listening.